Hi everyone, welcome back. So in this video today, I'm going to be talking about something called runner's knee, which causes anterior knee pain. So that's pain at the front of the knee. It can also be referred to as patellofemoral syndrome, which is a board term. Again, which basically describes pain at the front of the knee. And this can be due to various knee problems. And I'd say this accounts for around 25% of knee injuries that are seen by a sports therapist. It's known as runner's knee because, surprise, surprise, there's a high incidence among runners. But it can actually affect people who have both active and sedentary lifestyles. Runner's knee is more due to abnormal mechanics than it being a structural issue with the ligaments and the cartilage. So if I give you picture, because we like pictures. So basically what happens is, this is looking at your knee head on. So the kneecap or the patella sits in a groove at the front of the femur, which is the thigh bone. So this is the thigh bone, this is the head of the thigh bone coming round here. And there's like a groove in the middle on the bottom of this bone. And the kneecap sits in that groove, which is lined in blue here with thick cartilage. And this this cartilage sits between the thigh bone and the tibia, which is the bigger bone in the lower leg. And but this groove of the thigh bone, basically what that does is it allows for a wide range of motion of the kneecap, but it also means that when the knee gets hit with some sort of impact while it's in a flexed position, so for example when you're running, what this does is it forces the kneecap here. And if we look sideways on at the knee, so this is the thigh bone, the cartilage, and the kneecap, which is held by ligaments either side. So the kneecap is forced to bump against the groove in that bone. And this increases the stress on that cartilage and therefore causes pain. So that's the basic problem. So taking that into account, that we're looking at impact on the knee when it's in flexion, taking that into account, things like running downstairs or downhill, doing squats, these are the things that will increase the impact on those knees, and therefore potentially cause runner's knee. Now, there are some quite common misdiagnoses of runner's knee. There are various other conditions that can cause pain at the front of the knee. So this will be things like chondromalacia patella, which is characterized by actual structural changes in that cartilage that sits between those two bones. So there are actually structural changes in that cartilage that lines the kneecap. Also, there's something called jumper's knee, which is due to irritation of the patellar tendon, which sits just below the knee. And also one that I have covered in another post is iliotibial band syndrome, or IT band syndrome, which is due to irritation of the IT band, but that's on the lateral or outer edge of the knee. So each of these things can cause pain at the front of the knee, but it just tends to be in a slightly different spot. So now, in terms of what causes runner's knee, who is most at risk? Well, for some reason it seems to affect women more than men. And it's believed that this is because women have wider hips generally. But it's thought that if you improve hip and quad strength, that should help, which we will come on to. Also, things like flat feet. So again, because if you've got flat feet, you tend to have slightly turned in ankles. By that I don't mean that the foot's turned in, but they just slightly, it changes the position of the foot. So wearing things like rigid arch supports in your shoes, that again will just help correct that angle. Because when the ankle is sort of pulling in, that again affects the angle that ligaments and muscles and the IT bands cross the knee. So as with most of these sports type injuries, overuse is a major cause. So in this situation, it's repeated flexion of the knee with high stress exercises. So again, we're talking about things like squats and lunges, where the impact hits the knee while it's in flexion. But also it could be caused by a direct impact to the knee. So again, sort of contact sports, that have a high risk of injury. So rugby, anything where there's a tackle, that could be applicable. Chondromalacia patella, which we've just mentioned, where the cartilage below the kneecap breaks down due to friction at the back of the knee. So if that breaks down, then that can then cause pain around the front of the knee. Foot problems, again, which we briefly touched on. So again, flat feet, where the arches of the foot have fallen. Overpronation, which will affect the gait, and again the angle of certain soft tissues crossing the knee, and also hypermobility could be included, and again that's going to affect sometimes the elasticity of the soft tissues. They may kind of be naturally a lot looser and more relaxed, and so the way that the joints then receive an impact will be different. Now, malalignment of bones would be another. See, a lot of these are anatomical kind of issues. Malalignment of the bones from the hips right down to the ankles again will put excess pressure on certain areas, and may mean that the kneecap doesn't move smoothly in that femoral groove. And there may be some sort of anatomical abnormality. So, everyone's built differently. There can be variations in the shape of that femoral groove, and or the kneecap. And again, anything slightly outside the norm may again restrict movement, increase friction of that kneecap against the end of that femur, because it may mean that a slight change in shape means that the kneecap and that groove don't quite line up properly, and therefore increased friction. Now, we talked about women being more at risk of runner's knee, and we talked about that probably because they tend to have wider hips than men. And this is where we talk about something called the Q angle. So the Q angle is basically the angle of the thigh bone, which, depending on the higher that angle is, then the more strain that is put on the knee. And so if you think of looking at a man and a woman as a skeleton, where you have the thigh bones, you'll tend to find on men, they tend to be a bit straighter. The thigh bones coming down tend to be a bit straighter. But with women, because they have wider hips, so that angle sort of tends to come in a bit to accommodate the wideness of the hips. And so that angle around the knee at the bottom of that thigh bone is going to be increased on the knee, which then means a greater impact again. And therefore, increased irritation, increased pain. Now, of course, the muscles can impact as well. So any tightness on particularly the hamstrings or around the hip flexors may cause either an upward or sideways pulling of the kneecap, which again is going to increase friction, increase pain, due to basically not being able to move properly. And again, if that kneecap is being pulled up or sideways, again, it's not going to sit in that femoral groove the way that it should. Also, any weakness or imbalance in the muscles, particularly looking at the inner quads and the hip flexors. Again, what this means is that there will be reduced support around the knee, because when we think those quads, actually they all cross the knee, and they're the muscles involved in knee flexion, and reduced support around the knee. It's going to mean higher impact again on the kneecap. Muscle weakness on one side of the knee will also cause a slight shift of that kneecap in the femoral groove, which again will result in friction and then pain. Now, if we look at the fact that runner's knee, as the name suggests, affects a lot of runners. Runners often have strong hip flexors, but they have a tendency to have weaker glutes, which can sometimes cause an inward rotation of the femur or the thigh bone. And what this does is it pushes the kneecap to the edge of the femoral groove, So again, it's not sitting nicely in that femoral groove, which means that there will be limited movement, increased, friction and irritation, which then means increased pain. So there's quite a few, causes of runner's knee. Now, if we look at symptoms, and again, sometimes the symptoms on, a knee is a very complex joint, and much like with shoulders, quite often the symptoms in a lot of these problems will be very similar. So it's important to have a good thorough assessment. If you're sort of, this becoming a sort of quite a big issue. Symptoms with this tends to increase gradually. They may come and go, but they will certainly worsen with any prolonged activity. So, and again, that we're looking at those high impact activities when the knee is in flexion. So again, things like running downhill, running long distances, squats, lunges. Doing anything like that for a prolonged period, you will notice that the pain gets worse. Again, sort of if you use stairs a lot, especially coming down the stairs again, where the impact on that knee is higher. Again, you may find that the pain worsens. Sitting for long periods. So if you have a desk job or maybe you drive long distances for work, again, if the knee is kept maintained in flexion at a low level of contraction, again, you're going to find that this will increase the pain. But so the main symptoms are obviously pain, which, as we've said, is usually at the front of that kneecap. There may be mild swelling around the knee, and you may notice upon movement that there's either a popping or a grinding feeling in the knee. But those are really the three main symptoms. Now, in terms of treatment, this is something it may improve on its own with time. If you catch it early and you make those adaptations that we've talked about, potentially you could actually give it enough rest and it will improve. Certainly, as with all sports injuries, RICE, so that's your rest of the knee, so avoiding things like running, squatting, lunging, sitting or standing for long periods. Ice the knee to ease pain and swelling, usually for 20 to 30 minutes every 3 to 4 hours for maybe 2 to 3 days. Compression. Okay, then compression. So using a compression bandage or some sort of knee brace, preferably one that has the hole in the middle at the front, because this will basically ease the pressure off that kneecap while maintaining support of the knee joint as a whole. And obviously then elevation, keeping the leg up to help reduce any inflammation, which will therefore help ease pain. Also anti-inflammatories, so if there's swelling, anti-inflammatories can be used for the pain, but obviously do be careful with things like ibuprofen if you have gastric problems or if you're asthmatic. Also, if the runner's knee is caused by any kind of foot issue that affects your gait, so things like if you've got flat feet, you can try using arch supports to improve the position of the feet and that Q angle of the thigh bone, and so therefore the angle that all the soft tissues cross the knee, which will help reduce the impact on the knee. Strengthening exercises, especially the quad muscles, which all cross the knee, and also the glutes, to reduce the stress through the knee joint. And also strengthening these muscles will help to really just improve the position of the kneecap in that femoral groove. Stretching tight muscles to again improve the kneecap position, reducing friction. Just ensuring that that kneecap isn't being pulled to one side or being pulled up, maybe by tight hamstrings. Manual therapy, so massage, to improve any tension or imbalance in the muscles, which again helps improve the position of the kneecap. In really severe cases where the cartilage of the knee is damaged, surgery may be an option, but it really is a last resort. So now, in terms of recovery may take between 6 weeks and 6 months. You can exercise as long as it's low impact on the knee joint. So swimming, great. But, not really running or squatting, lunging, those are a no-go. Strengthening and stretching exercises, but they may take a few weeks, to improve muscle strength. If you really want to run, then just, ensure that you are wearing good supportive running shoes. Avoid running on hard surfaces, because if you do that, the impact on the knee, again, is going to be greater. And I'd say run on a level surface. Don't run downhill or uphill. And don't return to workouts before you can fully bend the knee and straighten the knee without pain. Don't return to workouts before you can walk, jump, run pain-free. And don't return to workouts until your affected knee is as strong as your uninjured knee, because otherwise, you start doing workouts with muscle imbalances and joint imbalances, you're asking for an injury. So in terms of prevention, there are some things that you can do, a lot of which we've kind of mentioned already, but certainly regular exercise to maintain the muscle strength in the thigh, so those quad muscles and also the hamstrings. Try to run on softer surfaces that place less impact on the knee, so try running on grass, and again, on a sort of level area, not running downhill or uphill. Warm up before working out with the appropriate type of stretching. Replace running shoes once the sole has become worn or they lose their shape, they're not supporting around the ankle. And if you've got foot problems, use those arch supports, just so that you're kind of correcting the angle of the ankle and therefore at the knee as well. If you do need extra support while working out, wear a knee brace. And as we've said, one of the ones with a hole at the front, which will support the knee, but take the pressure off, directly over that kneecap. And avoid any sudden changes to your workout. So you don't want to suddenly go and add in a whole load of squats or lunges, which again are high impact on the knee and will irritate that kneecap further. And just generally, try to maintain a healthy weight, because as we've said, if you're overweight, that is one of the risk factors and will cause postural changes. So yeah, again, that's just going to affect the angles at which the soft tissues cross the knee. So now I'm going to focus on runners now, because there is a high instance of runners that get runner's knee. So tips for runners. Keep your mileage below the pain threshold. See either a sports therapist or physiotherapist who can assess your pelvic alignment and recommend some kind of strengthening program to improve the mechanics of that patellofemoral joint and how the kneecap sits in that groove of the femur. We know that research shows that women with runner's knee have greater hip instability in their gait. So for women, strengthening the hip flexors, the glutes and the quads, should really help. Research also shows that those with runner's knee have a much greater short-term decline in hip strength than those without runner's knee. So anyone with runner's knee should be looking at exercises to improve hip strength and also core strength. Research also shows that when runner's knee is due to overuse, as opposed to, a traumatic injury during maybe a rugby tackle, for example, the recovery time is slightly quicker with overuse when focusing on hip strengthening as opposed to knee strengthening. So certainly that Q angle of the thigh bone and the pelvis is certainly very an important factor, even though the problem is actually sort of manifests in the knee. In terms of exercises, there are some that you can do, which I'm going to show you. And for these we will focus on weak hips and targeting the inner quads. There are a few for those, and then we will look at tight hamstrings and hips, and then we're going to talk a little bit about massage for runner's knee, just to finish off. So first off, we're going to look at exercises to target weak hips and inner quads. And so these exercises will help to improve the alignment of the hip and the knee. And these exercises can be done either just with your own body weight, or as you progress through recovery, or if you're using as a preventive measure, you can use a resistance band as well. So the first one we're going to do is lying on our side, and so this is called a clamshell. So prop yourself up on your forearm. So we're going to externally rotate this top hip while lifting the top knee towards the ceiling, but we're going to keep the feet together, okay? And so we're literally going to hinge at the hip, keeping those feet together to point the knee towards the ceiling. Lower back down, and then you'll just repeat. And down. And you're going to repeat this a few times. Holding. And that's going to work around those hip area. So the next one is the donkey kick. So we're going to position ourselves on all fours, shoulders over wrists, and knees right under hips. And we're going to extend one leg up and back, raising it to hip height with the foot flexed. Then we're going to press the heel towards the ceiling, making sure that the back stays flat and the knee points straight down. And then we're going to return to hip height. And we're going to repeat and down. And again, you can do this with a resistance band if you want to just work that a little bit harder. Okay, so the next one for the hips and inner quads is the fire hydrant. So this one again on all fours, shoulders over wrists, knees right under the hips, and keeping the knee bent at 90 degrees. We're going to lift it out to the side, up towards the ceiling. Making sure you don't drop into this opposite hip. And then you're going to lower back down and you're going to repeat. Again, making sure that this other opposite hip maintains the same position and you're not like kind of dropping into that side. Just lifting it up to the side, maintaining the 90-degree angle at the knee and back down. Okay, so then we're going to do a straight leg raise, which you can either sit or lie face up with the legs straight out, and we're going to lock out the leg as we lift it straight up towards the ceiling, and we're going to then hold it for 3 to 4 seconds, lower back down and repeat. So the key with this one is to keep the leg totally straight. So we're going to straight up towards the ceiling, hold it, and then lower back down and repeat. Now you're also going to feel that on the hamstrings at the back of the thigh. You want to make sure that you're actually working that vastus medialis muscle, which is that teardrop shaped one on the inner knee, directly above the knee. And you can actually make sure that you are working that muscle by placing your hand on the muscle above the knee, slightly towards the midline, and you should find that it activates while you lift and hold your leg. So again, you're going to lift, but keep hand up. And that muscle just on the inner knee there should be activated. So just check that when you lift the leg up. Okay, so we're now going to look at exercises for tight hips and hamstrings. Now, a combination of massage, stretching and foam rolling will prevent and treat muscle tightness by maintaining flexibility. Now, the first one again, like we've kind of already done, is that hamstring stretch. So lying on our back, pulling one leg straight up towards the chest, and you'll feel that pull right down there. But we're not going to engage that. Before we were, focusing on engaging that vastus medialis. This time it's more for the hamstring. So that's a real basic one. But then the next one is for the hips, which is running lunge. So we're going to have one foot in front, okay, and the opposite knee on the ground. And then we're going to press the hips forward, engaging through the back glutes there, okay. And you'll also feel a bit of a stretch down the front of the hip there. And then relax. And then again, you can repeat a few times and then repeat on the opposite side. Now, the next exercise focuses on the piriformis muscle, which is deep within those glutes. And so this one is called four-figure stretch. So again, lying on the back, we're going to cross the ankle of the affected leg over the opposite knee. And we're going to grab the back of the thigh that the foot is on the floor, and we're going to pull it towards our chest. And you'll feel a stretch just down in that piriformis, in the glutes of that leg that's bent across the knee. And you're just going to hold it and then relax back down. And then you're going to repeat a few times. And then if you want to repeat on the other side, you can. Other things you can do for the hamstrings, foam rollers, actually also for the quads and the IT band as well as the hamstrings. And again, do watch my previous video which compares foam rollers to stretching and sports massage, because it goes through all the pros and cons of each of those methods. And there's actually a lot of things that people do wrong when using foam rollers, so do have a look at that. Some people also will just use like a tennis ball, which can be good for rolling out those posterior glutes. So that's another option on top of the exercises. Okay, so in terms of massage for runner's knee, certainly it is effective in relieving pain associated with runner's knee, and it does this by stretching and loosening those muscles around the knee joint, and when done, in conjunction with some of those exercises, that further, increases the success of the treatment. Massage will also help improve the alignment of tendons, muscles, not only around the knee but also around the hip, which may, potentially reduce recovery time. Common types of massage for runner's knee would be deep tissue massage, certainly sports massage, and also maybe some trigger point therapy in with that as well. But as always, do ensure that you see a registered therapist who is experienced in this area. Yeah, that's pretty much sort of the basics of runner's knee. So as always, if you have any questions, feel free to comment down below, or you can contact me through my Facebook or Instagram page, and I will do my best to answer any queries you have. Feel free to subscribe to my channel, because there will be more sports injury related posts coming up. While we're on the topic of knees, I will also be doing one on meniscal tears in the next, hopefully, few days. Yeah, for now, that's all from me. So take care, and I will see you next time. Bye.